everyone. In this video, we will discuss dissolution method development for extended release, that is ER tablets. Extended release tablets are designed to release drugs slowly over 8 to 24 hours. Because of this, their dissolution method cannot be same as immediate release products. For ER tablets, method must mimic gastrointestinal transit, capture the true release mechanism, demonstrate controlled release across the entire dosing period. This means different media, longer test duration, carefully selected time points, and appropriate hydrodynamics. In short, ER dissolution method development is about control over time, not speed. Safety is critical, especially for extended release tablets. ER products must not release the drug too quickly because dose dumping can lead to serious safety risks. That's why drug release mechanisms directly guide how we design dissolution methods. Long release window, often 8 to 24 hours, complex mechanisms like diffusion, erosion, and osmosis, multi-stage pH environments that mimic GI tract, higher regulatory expectations for control and predictability. Understanding the mechanism helps us select the right medium, apparatus, and sampling points, and ensure the formulation release drug slowly, safely, and as intended. Without understanding the drug release mechanism, it's easy to choose the wrong media, apparatus, and sampling times. Different systems behave very differently. Diffusion control systems form a polymer gel layer that regulates release. Erosion control system release drug as matrix gradually dissolve, often in pH dependent manner. Osmotic systems deliver drug at near zero order release through a small orifice. Hybrid systems combine two or more mechanisms. Because of this, hydrophilic matrices, osmotic pumps, and erosion type tablets cannot be tested the same way. Many ER products change their behavior across different pH stages, which is why apparatus selection is critical. Different systems need different hydrodynamics. USP apparatus 2 is most common for ER tablets. USP apparatus 1 is preferred for floating or eroding tablets to prevent surfacing. USP apparatus 3 is especially useful for pH transition and multi-stage studies. USP apparatus 4 works best for low solubility drugs and challenging formulations. Osmotic tablets may perform well in apparatus 2 or 4, while floating ER products require a basket to ensure proper immersion. Extended release products require multi-stage dissolution testing because their behavior changes as they move through the GI tract. In many ER formulations, coating may swell, erode, or respond to pH. Matrix system change release rate with environment. Osmotic tablets are largely pH independent but still need a physiological relevant setting. That's why we use pH transition to mimic GI control, such as pH 1.2, pH 4.5, and pH 6.8, with stage duration aligned to gastric and intestinal transit times. Key principle to remember: avoid surfactants unless they are truly needed for sink conditions. Use biorelevant media like fasted or fed intestinal fluid for low solubility APIs when justified. Always balance physiological relevance with method discrimination. Hydrodynamic issues are common in dissolution testing, and RPM is often the solution. You may see coning where particles settle under paddle, sticking to the basal bottom, floating, especially for low density or coated tablets. Adjusting rotation speed helps control these effects. Regulators, including FDA, generally prefer using the low RPM that still provides reproducible results. The typical working range is 50 to 100 RPM. Key trade-offs to remember: higher RPM reduces variability and hydrodynamic artifacts. Lower RPM improves discrimination between formulations. Choose RPM based on formulation behavior, like matrix tablet 50 to 75 RPM, osmotic tablet around 75 RPM, eroding tablets higher RPM to prevent coning. Sampling time points must match the release mechanism. For osmotic system, hourly or evenly spaced time points are important to confirm linear zero order release. For erosion control system, more frequent early sampling is needed to capture initial matrix breakdown. A good dissolution profile should always cover early phase, that is onset of release, mid-phase, controlled or steady release, late phase, completion of release. Typical time points may include 1, 2, 4, 6, 8, 12, 16, 20, and 24 hours, adjusted as needed. The key is to reflect the true release kinetics, whether zero order, diffusion based, or erosion based. Avoid adding unnecessary time points that increase variability without adding insight. Discriminatory dissolution testing is a regulatory expectation, especially for SUPAC MR and ANDA submissions. Regulators want proof that the method can detect meaningful formulation or process changes, not just pass compliant batches. That's why during development, teams often create intentionally varied batches to demonstrate discrimination, such as changes in polymer grade or concentration, tablet hardness, granulation process, coating thickness, especially for coated ER tablets. A good method can clearly separate these variants. At the same time, avoid over-aggressive conditions such as excessive RPM or surfactant level can mask real differences, creating regulatory risk. Extended release tablets often have a high drug load, so maintaining sink conditions become critical. The dissolution medium must be able to dissolve at least 3 times of the total dose of the entire test duration, not just at the beginning. Common media volumes are 500 ml, 900 ml, and 1000 ml. If sink conditions are still not met, use surfactants only when truly needed and scientifically justified, or switch strategy, increase flow rate or use media replacement with apparatus 4. The goal is to maintain constant dissolution driving force without masking formulation differences. For extended release dissolution methods, long duration stability in the dissolution medium is essential because these tests may run 8 to 24 hours. We must confirm that the drug remains stable in the medium for the entire test duration. Robustness testing is critical and should include deliberate variations in RPM, medium pH, degassing conditions, basket or pedal alignment. This ensures the method is reliable and reproducible under real lab conditions. Final method validation must be performed in line with ICH Q2R2 and should cover precision, accuracy, specificity, robustness. In addition, perform filter compatibility studies, confirm drug stability in medium up to 24 hours, and define clear QC acceptance criteria. To wrap up, an effective dissolution method must balance physiological relevance, robustness, and discriminatory ability. It all starts with understanding the release mechanism. From there, follow a structured, science-driven approach. Select the right apparatus, choose appropriate media and pH transitions. Optimize agitation speed, set long duration, meaningful sampling points, ensure the method can discriminate formulation and process changes, and finally validate the method. Thanks for watching. In next video, we will discuss dissolution method development for capsule, gelatin issue and solutions. Please subscribe us for getting update on upcoming industry application oriented videos, and stay tuned because in this 62 video series, we will cover dissolution method development, validation, troubleshooting and many real industry examples. Please share your queries in comment section. See you in next video. Thanks.